Hapo kwa sawa. Sawa. Hapo ndio muonekano. See? Are we okay?
Yeah.
Let's start.
So morning. Yes. We are here today and it's a week time to the World AIDS Day. Basically we are here to help to join hands in fighting HIV in Kenya, and with the rollout of UHC, we anticipate that maybe the government is doing something to help in fighting HIV in Kenya. So maybe if you have statistics apart from what she maybe say, or the statistics maybe on what the government has to help in fighting AIDS through the UHC program, and maybe if there are statistics, then maybe you can highlight about that, and what the clinic that we run today will help in benefiting the people of Mathare and even Kenya as a whole.
Thank you. Let me start by introducing myself. My name is Mathare. I'm the Principal Secretary, State Department for Medical Services. Today, I'm honored to preside over the official opening of the AIDS Healthcare Foundation building here in Mathare. And I've also been taken through the journey of the AIDS Healthcare Foundation, where they've started here in Kenya for the last 15 years. And we are very happy with the progress that they have made, because they have started with 2 counties, Makueni and Mombasa, but now they expanded to 10 counties. And we are very encouraged on the investments that they have put in place, specifically on this building, that they are going to cater for more than 100 patients per day. And also they are going to serve more than 300, a population of more than 300,000 within this area. As a government, we are very happy to partner with the AIDS Healthcare Foundation. We are going to support them in TB drugs. We are also going to support them with the HIV AIDS drugs, so that together with the Nairobi County and any other support that they require, the government will provide that support. We've noted also that they are not only just serving sick people, they are also serving, they have made a provision for the street families, so that they can also support the street families, which is really encouraging. And I've discussed with the management, we are going to have a joint approach in this, where we also have the social protection department coming in to support this institution, because of the vulnerable population, the street children that they are also supporting. I want to say that as we go towards the World AIDS Day, we celebrate World AIDS Day, I want to say that we are facing a lot of challenges, especially in the AIDS area, in the sense that there are a lot of youth now who are being infected with the HIV AIDS, and which is really a challenge to the government now. We are very happy that this institution, this foundation, have programs for the youth, that they will be engaging the youth, so that they are able to counsel them, support them at this particular time, because they are the ones now who are most vulnerable in terms of getting infected with HIV. The other program that the government has done to support such kind of institutions that have come in is that the new laws that we passed recently, one being the Social Health Insurance Fund, because previously we used to have challenges of chronic diseases, but now there will be a fund that will take care of the chronic diseases. HIV, AIDS, TB is among those chronic diseases that the government is targeting to support. So they will be getting, as long as they are registered and they meet all the obligations, and then they will also benefit from the chronic disease fund. They have also told us that they are also offering other services, not just only for the HIV/AIDS, that they are offering other services for other diseases, and that also comes in under the primary healthcare fund that they will be able to benefit from. So, as under the social health insurance, this institution is going to benefit a lot, and that will also help improve the facilities, improve the service within this area. Yes.
So it appears there's speculations that in years to come, maybe USA will not help in Kenya in terms of drugs for AIDS. Maybe as a country, as a government, what are your plans towards this? What is going to be the fate of our people?
We've been working with the partners, the PEPFAR, for example, the Gavi. We have been having the Global Fund supporting in government in fighting AIDS, and we do know that we have a program that initially it was meant to be by 2027, that they will withdraw their support, because that was the arrangement, that was the agreement between us and the partners. However, because of the challenges that the government is facing currently, especially on the economic side, the fiscal space challenges that we are facing, we've been engaged with the partners, and we've agreed that until 2030 is when they will stop the funding and where the government will be able to take over. But you can see what the government is doing in the health sector is they are doing a lot of reforms. Key among them is a social health insurance. That is the one that is going to support the government in achieving its universal health care coverage, and where the donors will have withdrawn their support. So once everybody pays in the social health insurance, and we're going to do that, now that we have a new board, we're working on the regulations so that we're able to register all the households to be able to benefit from the social health insurance. Then we will be able to take care of our health care within the country without the support of development partners. So Social Health Insurance Act will support us in that area because we've made a provision for it. The other one is also on the Facility Improvement Fund, where we're working with the counties, that the revenue that is obtained from those health facilities are retained within the health facilities so that they're able to continue procuring drugs to treat the patients. So you can see we have put in elaborate measures, in fact in terms of legal framework to support our healthcare system, so that when the donors leave, we'll be able to take care of our healthcare system.
Lastly, what are the 10 counties that you just mentioned, and why did you choose the 10 counties?
I think it is the partnership that decided the AIDS Healthcare Foundation started with the 2 counties, I said Makueni, Mombasa, but they have told us that they've expanded to Taita Taveta, Kilifi, Kwale, Homa Bay, Turkana, and Nairobi itself, you can see, Murang'a, Kisii.
Next year we are going to Migori.
And next year they are going to Migori and Nakuru. So that shows that the management of this foundation are geared to support the government programs, and they are aligned to the government agenda of providing universal healthcare coverage. We encourage more of such foundations, more of such providers to come on board to support our government and our county governments to ensure that we support the county. But I think what we have done basically so that we're able to attract more of this is the amendments and the new laws that we have passed, the legal framework, where most of them are now going to benefit, because those who are eligible for claims from our social health insurance will be able to benefit, and also the framework that we put in terms of government support to the social health care. To provide universal health care is really critical. So we call upon the private investors, foundations, and individuals who are able to invest in the healthcare system to come on board, because now we've made legal amendments and we also passed laws that will be able to support their investment within the health sector. Yes.
Maybe finally, ambiguous a little, but I think you have something to say about this. Basically, I've heard a story I've been doing about women suffering in marriages. So their men have been forcing them to have anal sex, and they realize most of them that they've been having problems, mostly associated to maybe these STIs and AIDS. So as a government, maybe because this might be a new way of transmitting this disease faster, do you have maybe something to do? And maybe if now that it has come to your ear, can you maybe have something to regulate this so that maybe women have a voice to speak about it? And because now it's happening in our marriages, are we at risk of maybe increasing the people that are getting infected with HIV?
I think we have the National Syndemic Disease Control Council that have come up with the programs, policies and strategies to ensure that we address those challenges. Of course, we have challenges now in marriages, gender-based violence. We have a lot of other things, abuse. But we have come up with strategies and policies that are able to address that. I think we have the CEO of the National Syndemic Disease Control Council who come up with these policies, especially on HIV/AIDS area. I think I can give her to respond to some of those issues so that she can tell you specific interventions that have been put in place.
Thank you.
Yeah.
But
Masha?
finally, we are just a week away from World AIDS this year. What's your message to Kenyans who are infected with the virus? What is your general message?
The general message is let us not drop the ball. As a country, we have made a lot of strides in fighting AIDS. We've achieved a lot. We've seen in some cases, some counties, their prevalence of AIDS have gone down. Areas where counties which had high prevalence cases have gone down. But I think we are seeing also in other counties now, they are emerging cases, increasing HIV infection cases that are going up. We want to call upon the public and request them that let's not drop the ball at this particular time when we are just about to end HIV AIDS in our country. Let's ensure that we continue with the messaging of AIDS so that people are aware, the youth are aware that we've got to join hands to fight HIV AIDS in our country.
When do we intend to stop maybe new infections in the country? What is our limit?
And maybe additionally, maybe you can talk about prevention of mother-to-child transmission as well.
Of course, what you're doing on the prevention of mother-to-child is that we're investing now in most of the facilities where we have equipment so that when they go for their clinics, they're able to be tested, they're able to be informed, they're able to be supported, and mothers are actually counseled on how to prevent the mother-to-child infection. So that the government is doing, and currently we have about bought some equipment for testing of children, the viral load on the children at a very early stage in about 26 facilities. This was we're doing it on a test basis, and we want to upscale the same so that it covers more areas, more of those clinics, so that they're able to prevent mother-to-child infection. So we, as I said, we are investing more on commodities. We are buying more commodities. In some of our programs, we are doing reprogramming within our global fund programs, where we are now supporting more of purchase of the health commodities so that we are able to treat more, as opposed to where we've been doing programs of capacity building. We're now shifting to purchase of commodities so that we're able to prevent, especially on prevention, that is the condoms, and then we also have to buy the ARVs to make sure that all those who are infected are able to access this. We are also supporting TB, for example, and we are buying more of the X-ray machines so that we're able to do more, test them, confirm who are infected. And for example, this facility, being a private facility, the government will also support them by, if they have a lab, if they have extra rooms where we can bring some of these machines so that they're able to do X-rays and then support the government programs of reducing TB in the country. We've been told that this facility, for example, also carries out a test on TB. Out of it, from this facility alone, this year, they have seen an increase of about 17% of TB infection going up. So with that kind of data that we get from such facilities, to be able to help the government come up with more measures and policies to intervene, and especially the most vulnerable areas, because these areas, we know the challenges they're facing because they are the most vulnerable members of our society. So we want to support such, where they have put such facilities, the government will come in with machines, with X-ray machines to support them so that they are able to do more screening, and then give us the data, give us the numbers of those who have been infected, and be able to treat them.
Thank you.
Yes, thank you.
Thank you so much.
No, for her. We've not finished.
She was to
answer the one that you referred to.
Yeah, she can say something. Masha. And we also want to hear from Mheshimiwa. The voice of the politician is very critical in advocacy. So let's start, and the county government. So let's start with Mheshimiwa.
Thank you very much.
Just a minute, you test the camera.
Thank you very much. My name is Catherine Muma. I'm a senator, and with an interest in the right to health. today we have seen what in my view is a rights-based approach to health service delivery. And I will not take long. I'd like to congratulate AHF for the excellent work that they're doing, and would like to say that healthcare or health services in this country is a service that requires to be carried out in a partnership. We don't have enough public facilities to deliver services to everyone, and therefore jobs or works by the likes of AHF need to be supported. I'm very happy that the PS has committed that the ministry will work in partnership with AHF, and the county government of Nairobi has also committed that they will work with AHF. And as we do so, Bwana PS, I would want us to also focus on where the issues of HIV are. As syndemics will tell you, the highest levels of infections are among the youth. And within the definition of youth are lots of adolescents. We have lots of teen pregnancies, we have a lot of STIs among even young people. And the way to go is to start opening up conversation around the sex issues, which we have made taboo in this country. And that's why when you ask the question about your research among married women, everybody was laughing because it's a taboo subject. We are embarrassed to speak about these things. We need to open up this conversation. We need to support the ministry. We need to bring on board the religious community to say that we must have the correct conversation to prevent rather than to treat. I would be happy for us not to be worried only about diagnostic materials, but to ensure that if we had done something earlier, maybe the 2.5 teen pregnancies between 2016 and 2022 would not have happened. So we need to open up the spaces, we need to reorganize and readjust the programs that we have, particularly for adolescents, both boys and girls, on matters relating to sex education and sexuality in order to deal with these issues. Thank you very much.
Nairobi County.
My name is Geoffrey Mosiria, Chief Officer Health Facilities. First is to appreciate for this initiative. First, I want to tell you that the county government, we have invested heavily on HIV treatment and also in prevention. And it's not only about treatment. These clients, there's other diseases that come along with HIV, and that's where we have ensured that all our health facilities are equipped with the necessary equipment and also the medicines to serve these clients. And I also want to appreciate the national government and our president with the FIN bills. Now we are able to ring-fence this fund so that we have fund being spent at source. So when we need the medicine, we are able to procure on site. And now with the AHF, we are going to strengthen our partnership, and we have been working closely. They have been working with our sub-county CHMT, especially in doing joint supervision, and now that they have made a request that they require support in some of the NCDs, we are looking forward to supporting you and ensure, because we are serving the same people, the residents of Nairobi, we are going to work closely to make sure that these young people, especially the adolescents, they are able to get that care. And this is a group that has been really forgotten. And I'm happy. I'm also a youth. And being a youth, our core business as the county government is to make sure that everyone has access to quality healthcare. And as the county government, we are also guided by the Ministry Policy and we are going to work closely with the Ministry of Health so to ensure that the client, the residents of Nairobi, are able to access quality healthcare at any given time. Yeah, starting from all our level 2, 3, 4, and 5 facilities to ensure that we have all we need to treat these clients. And what I want to add is the young people out there, kindly let's be careful because this disease is there. Some of the young people, they don't care. Some are taking drugs, some alcohol, but and with the ministry, we ensure that even our entertainment joints, we have a condom dispenser so that, and it should be made mandatory, so that whenever these young people, they are drunk, sometimes they just go, they engage in unprotected sex, and this is what is contributing to this increase in HIV. So that's something we request our peers from the national government. They ensure that it's a mandatory requirement for any entertainment joint and any public that when there's maybe an entertainment joint, even in our churches, because we need to have condom dispensers, especially for these young people, because most of them fear going to buy the condoms from the shops, and they end up having unprotected sex, and that's why we are having HIV that could have been prevented. Thank you.
Our champion ameongea, Ferdinand Omanyala.
Let's have her, and then we have Omanyala maybe at the maybe position.
So this is our Usain Bolt.
Usain Bolt, lazima
Thank you very much. My name is Dr. Ruth Masha. I'm the CEO of the National Systemic Diseases Control Council. We are here just about to celebrate the World AIDS Day on the 1st of December 2023. And we did, as a country, we made progress. We currently have about 1.4 million people with HIV. Kenya is the 7th highest burden epidemic of HIV in the world. And also we do recognize that while we have made significant progress in reduction of HIV infections, last year we had about more than 22,000 HIV infections occurring, mostly among young people. And then we also had 18,700 deaths related to HIV. And we are saying that we have done a good job, but it's not over. Questions about what we do about new emerging things, including what we have seen on sexual and gender-based violence, intimate partner violence, which we have referred to in terms of people having sexual experiences that they are unwarranted. We do refer that to a situation where we call it as intimate partner violence, and we, as a program, suggest and always give information that everybody should have the agency to prevent themselves from being infected. And we are putting programs for public education just to ensure that people are aware that sexual practices should be where people are of mature age, and also where there is consent. And that is basically one of the areas. We've heard about other methods, including condoms. We have drugs for prevention of HIV. We also have programs for preventing those who are injecting drugs, and we're also encouraging the country that the drug injecting practices is becoming very high prevalent. We are calling on communities, because this year we are saying let communities lead. It is impossible for the government without the partnership of the community to prevent some of all these practices that we are hearing, and we are asking us to educate each other, parents to educate their children, and also across the settings that we have, including the religious platform and the schools. So we want to welcome everyone. Every county will have their World AIDS Day commemoration, and we want to take this as an opportunity to educate ourselves and to remind ourselves the job is not done. Thank you very much.
Our champion.
Yeah, today's not about me. Today's about celebrating HF, the 15 years that I've been working passionately and supporting health. Mine just to congratulate them as an ambassador of HF. I'm proud of them. And as we gear towards the World AIDS Day, my message to the youth, it starts with you. The responsibility is all yours. You can't say that let other person protect themselves for me. They can't. It can't work like that. As athletes, we say you are responsible of what goes into your body and what you do with your body. So let's be responsible. And unwanted pregnancies and teenage pregnancies is one thing that you're really fighting in this country. At some point, I said if you love school-going children, nunulia bibi yako uniform, so that at least you can be attracted to her and don't give watoto wa shule mimba. So we are really pushing that message, and we hope that the youth take this seriously, because it's something that affects our bodies, and that's who we are. So congratulations, HF.
Asante sana. So Bwana PS, we want to thank you so much for opening this facility, and Mheshimiwa, our brand ambassador Omanyala, CEO County, on behalf of Mathare, asante pia ofisi yako pia kufikisha salamu zote. Thank you so much. Kinyanjui is our host today. So vote of thanks because we are finished. Yes. So thank you very much. Daktari kidogo hapo.
Yes. So thank you very much, Bwana PS. My name is Dr. Samuel, the country director, AIDS Healthcare Foundation in Kenya. We are delighted today that we have reached a milestone of 15 years. More importantly, we are delighted because of the number of lives that we have had an opportunity to impact positively. As healthcare workers, we committed ourselves to ensure that we prevent unnecessary suffering and premature death. As HF, we keep the clients as central. And we are grateful because of the commitment and support we got from the government of Kenya, the Ministry of Health, the attendant department, National Syndemic NASCO, and others. And particularly, I'd like to mention that the current legal framework has gotten all of us excited. That finally, we can get a mechanism where the government funding mechanism can also support NGOs, civil societies, faith-based to be able to deliver quality care to Kenyans. And finally, we can have the clients living with HIV and TB included in a national funding mechanism like the Social Insurance Fund. That is an exciting time for us. We thank the ministry, we thank the partners, including the papers, we thank the media, because without you, the word cannot get out there. And you, the message I'd like to leave, particularly with the youth, is that it is your time. And this fight with HIV, many battles have been won, but the war is still on. We're very close to the wire, but we need all the support we can get. The first support we need to get from is from the youth. The next support we need to get from is from the government. So the government puts funds where the donors are, when the donors are retreating. And for Health AIDS HF as an organization that is self-funding, we depend on funding, particularly from businesses and the organization done in the US. We continue to expand, but our business about HF, our vision is to have HIV controlled globally. That is the business. How we do it is our mission, is providing quality care and advocacy regardless of the individual who affords. So for those ones who can be able to afford, we are happy to accept the thing. For those areas of the people who cannot afford, we provide services for free at best. The doctor will never know who paid and who did not pay. So some clients in our clinic, particularly in Parklands, some clients insist. We have premium clients who insist on paying. They can pay 500, they can pay 1,000, some people can pay even 50,000 because they appreciate the service. We accept that. But for the ones, we use that one and the same model they use in the US to raise the funds that are now used in 44 other countries globally. So we want to thank you very much and appreciate the effort, knowing that this is just a start. Beside HIV, this clinic will also be offering STI screening and treatment, also reproductive health testing and screening. For people around here, we also offer OG every morning for the clients to make sure that they can go home with. They do not say they have an empty stomach. For the street families who are our customers, we have also included their services here and a place for them to do their usual cleanup and have time with us. They actually come every week. They don't come. They don't collect their drugs 3 months or 2 months. They come every week. Because they also, MCJs, you know, they may not have space to store drugs for 3 months. So they come every week. Kombea uji, down. Shower, change clothes. Wash the other clothes, leave them hang. We have somebody who takes care of those clothes, hangs them until they come inside. Thank you so much.
How many clients are registered under your facilities?
So we have over 100,000 clients in Kenya under our facilities, 2,600 here. And out of this, about 6,000 of those clients are actually children. Children being clients under 15 years of age. Yes.
Just a question. Why are you business question about the initiative of TB?
drugs. Maybe you can clarify this, whether we have drugs or don't. Thank you. Yes, we had a shortage of TB drugs in the country because the stocks that we were holding were getting depleted. And we had done the procurement, however, there were challenges on the side of the supplier. They were not able to supply on time. We've made arrangements, and now there are those which have been lifted, they have been shipped to the country. So that service has now resumed, and we have enough commodities for TB clients. Going forward, I think we are going to change the supplier because he did not meet part of the obligation. Yes.
Thank you.
Thank you so much. Nani ana story
tunazipata hapa na kwamba hii si mara ya kwanza au kwanza hii service hapa. Nasikia kumekuwa na hawa katika jumba lile lingine, lakini sasa wamekuja hapa, wamefungua. Nafikiri mtafurahi. Kama serikali tutaendelea kushirikiana na hili shirika kuhakikisha kwamba huduma mnazipata kwa njia ambazo mnafurahia, licha ya kwamba hii sio ya serikali, lakini sisi pia kama serikali ya kitaifa na ya kaunti tutashirikiana nao tulete zile kama madawa ziwa hapa, ili kwa sababu dawa ni dawa, si ndio? Yes. Haijalishi umeenda katika lile jengo la serikali ama umekuja hapa. So ya muhimu ni kuja katika kliniki hii mtibiwe na daktari awaandikie dawa, chukua dawa zenu ili muende nyumbani na muendelee na kupata matibabu. Kwa hivyo sisi na hili shirika tutafanya kazi, AHF tutafanya kazi kwa pamoja. Na muhimu ndio muendelee kupata hili huduma kwa njia ambayo serikali pia itawasaidia. Ni sasa tuko na shirika mpya ya serikali inaitwa Social Health Insurance Authority, ambaye sasa itakuwa inashughulikia magonjwa zote. Haitakuwa tunashughulikia zile magonjwa za basi, itakuwa inashughulikia hata ile magonjwa tunaita chronic illness, kwa mfano TB, HIV na blood pressure na ile sukari, diabetes. Hizo zote sasa tutakuwa tunashughulikia kupitia ile shirika letu, kwa sababu ukiwa na ile kadi lako kama umejisajili, wewe ukija facility kama hii utaweza kupata matibabu na utarudi nyumbani, kwa sababu ile kadi lako ambayo umejisajili naye inajulikana kwamba wewe unatibiwa ugonjwa gani, kama ni ile chronic disease ya diabetes, kama ni HIV, kama ni cancer, utaendelea kupata matibabu bila kuwa na wasiwasi, bila kulipa pia. Sawa sawa. Kwa hivyo nataka niombe kwamba wakati tutaanza registration, mjisajili ili muweze kupata matibabu. Hiyo matibabu utaipata katika shirika la serikali ya county ama ya NGOs, private hospitals, mission hospitals, zote itakuwa ni serikali itakuwa inashughulikia, ambapo tunaita universal healthcare coverage. Tunatakana ifikie kila mtu. Sawa sawa. Nataka nisema asante sana. Tunaona rais bila anafanya kazi, na pia tuko na community health promoters ambao watakuwa wanakuja kila mara kwa nyumba yako wakupime. Kama uko na shida ya pressure, anakuambia utaenda hospitali gani, na tunasema hospitali ya karibu ndio inafaa. Kama utakuwa na shida ya sukari, watakupima, wanakuambia nenda katika hili shirika na hospitali hii, watakutibu. Kwa hivyo tunataka mfanye kazi kwa pamoja na community health promoters katika sehemu ambayo mnaishi, na wako na uniform, mtawatambua. Wakija muongee na hawa, watapatia mawaida kuhusu mambo ya afya yenu, ambapo tunasema afya bado. Sawa sawa, asante sana.
Dakika moja niseme kwamba AHF pia huwa wana support community promoters. Previously tulikuwa tunaweka community health workers. Kwa sasa Kenya tuko nao 72 na tuna mpango wa mwakani kuongeza hii idadi kufikia 150 kushirikiana na counties, kwa sababu tunatambua kwamba kuzuia ni bora kuliko kutibu. Mswahili anasema usipoziba ufa utafanya nini? Itabidi ujenge ukuta. Na kwa hivyo pia tunawashukuru kwa vile PS amepata nafasi ya kuja, wametuahidi pia watatusaidia na hiyo dawa ya sukari na pressure kupitia kwa county pia. Kubwa county hapa. Tunashukuru sana kwa kweli, na tunawashukuru nyinyi pia kwa kungojea leo. Kawaida huwa hatuwaweki namna hii, tunawashughulikia. Lakini mkiona hii kliniki hii na ile mahali tumetoka, mnaonaje? Kwa nyumbani pale saa zingine hata siku jilikuwa inatoka.
Sio kawaida, sio rahisi kutokea. Pia mwananchi wa kawaida kibaya.
Sasa hapa
Nimefurahi.
tunashukuru serikali,
Tumeshughulikiwa vizuri na pia madaktari wetu wameshughulikia vizuri. Nimefurahi sana. Na pia wewe mgeni umeheshimiwa. Nimefurahi kwa kutembelea siku ya leo.
yes, hiyo ugonjwa wa sukari, ugonjwa wa blood pressure, kwa hivyo tutashirikiana na county. Najua tunawasaidia tayari, lakini tunaona uwezo wetu unaendelea kuwa mdogo kwa sababu kliniki inaendelea kuwa kubwa.
Hospitali za kaunti level 3, 4 hata 5 kuna madawa ya sukari, madawa ya pressure iko. So kama ni hapa, nenda pale Pangani utapata dawa ya sukari na ya pressure, na hiyo ni all the level, all our facilities ambazo ziko kwa hii area kuna hiyo dawa. Isilia center pia iko nayo, na pia na Mathare no na sasa tutasaini na hii facility MOU. Kimaliza tutakuwa tunawasaidia hiyo support hizo madawa, na pia tutakaa chini na governor tukaja tumwelezee kuhusu hii facility, yaone pia ile support ambayo ataipatia, na pia especially ile pia nawaomba we need to come out, tuambie watu kwamba AIDS ipo, we come out, kwa sababu mtu akijificha ndio watu kufa na stress na nini. We need to come out, usiogope kama umepata, usiogope kueleza wengine na kuwaadvise kwamba wajichunge, kwa sababu ukijificha nayo, mtu anajificha, inachangia nafika mtu anakuwa na stress na magonjwa yanamfuata na nakufa haraka. So watu wafanye nini? Wajikubali. Sasa
Asante sana.